Heart disorder is the leading purpose of loss of life within the US. 1 in each 4 deaths is because of coronary heart disorder. Extreme chest pain may be an obvious signal something is incorrect. But heart sickness can be lethal due to the fact many humans don't recognize some early signs and symptoms, and they do not are trying to find treatment till it is able to be too past due. Coronary heart signs may not continually be expressed, so do now not forget about any ability cardiac warning signs. Some warning signs not to disregard include shortness of breath, heartburn, muscle discomfort, painful hiccups, neck or upper lower back pain, or other symptoms discussed on this slideshow. Human beings with recognized heart ailment or vast risk elements, which includes humans over age 65, strong own family records of coronary heart disorder, weight problems, people who smoke, high LDL cholesterol, high blood pressure, or diabetes ought to pay more attention to any feasible cardiac signs and symptoms. It's miles important to be aware of any signs and symptoms which can imply coronary heart disease. Do not forget about them or watch for them to head away. See your doctor for trying out and diagnosis. Many people mistake coronary heart disease signs for heartburn or muscle soreness. When you have any cardiac sickness threat factors, along with being male, over age 65, have high cholesterol or excessive blood stress, are obese, a smoker, diabetic, or have a circle of relatives records of heart ailment, you want to pay extra attention to any ability coronary heart disease symptoms. One symptom of an approaching heart assault may be excessive anxiety. You can sense as in case you are having a panic assault and experience shortness of breath, palpitations, chest pain, and dizziness. In case you experience these signs, visit an emergency room right away. Chest ache is an average symptom of a heart assault. But, most effective, about a half of all ladies experiencing a coronary heart attack may additionally have chest pain. In addition, chest pain may be a result of different situations that are not associated with the coronary heart. While chest ache is coronary heart related, it is often focused under the breastbone, slightly to the left of middle. It may sense like excessive stress on the chest, or simply an uncomfortable sensation of strain, squeezing, or fullness. Ladies might also enjoy minor aches or even a burning sensation. Any chest pain ought to be delivered to the eye of your doctor, who will help diagnose the motive. In heart failure, fluid may additionally collect inside the lungs, inflicting a continual cough or wheezing. From time to time the cough can also produce bloody phlegm. If you have a continual or worsening cough or wheezing that makes it tough to breathe or impacts your daily life, see your doctor. Heart assaults and heart rhythm abnormalities called arrhythmias can result in dizziness, lightheadedness, and even fainting. Many one-of-a-kind conditions can cause these types of signs and symptoms, so see your doctor to discover if heart disorder is the reason of your dizziness. Fatigue is one of these symptoms that can be attributed to many special clinical conditions. Every so often girls mainly to enjoy unusual fatigue during and in the days prior to a coronary heart attack. Heart failure can cause human beings to experience tired all the time. Whilst you are so fatigued it influences your everyday feature iron, it's time to see your doctor. Nausea, indigestion, vomiting, or belly swelling can occur all through a heart assault. Occasionally the poor flow due to a weak coronary heart or blocked arteries can reason these symptoms. This is commonplace in ladies, and regularly gets worse with activity and improves with relaxation. If you are experiencing nausea or loss of appetite that follows this pattern, see your physician. Whilst chest ache is not unusual in a heart attack, ache might also occur in different areas of the body. Many humans revel in heart assaults as ache that starts within the chest and spreads to the shoulders, hands, again, neck, jaw, or stomach. Guys may also revel in pain of their left arm all through a coronary heart attack. Women may enjoy ache in either arm or between the shoulder blades. The ache can also come and pass and can be slight or severe. In case you experience ache just like this, go to an emergency branch immediately. You may be experiencing a heart assault. An occasional skipped heartbeat can be no motive for subject. But if you have a speedy or irregular heart rate, this will be a symptom of a heart assault, coronary heart failure, or an arrhythmia. This speedy or abnormal pulse may also be observed via weak spot, dizziness, or shortness of breath. Searching for scientific attention right now, a few arrhythmias can lead to stroke, coronary heart failure, or death without active scientific intervention. Throughout a heart assault or coronary heart failure, fluid may leak into the lungs, causing shortness of breath. People may feel breathless even at relaxation. Shortness of breath can be because of different situations consisting of persistent obstructive pulmonary sickness. However, it could additionally be a signal of coronary heart assault or heart failure. Breaking out right into a surprising sweat for no cause is definitely a common symptom of a heart attack. Sweating profusely whilst you do not have a fever and are not exerting yourself or in a warm environment, particularly if accompanied with the aid of different signs and symptoms including lightheadedness, shortness of breath, nausea, or chest pain, can be a symptom of a coronary heart assault. Whilst the heart is weakened, it pumps blood less efficiently, and this may result in fluid retention that outcomes in swelling, edema, of the lower extremities or stomach. Coronary heart failure also can purpose surprising weight gain and loss of urge for food. Severe and unexplained weakness can be a sign of an imminent heart attack. The heart is unable to pump sufficient blood to meet the frame's needs. Blood receives diverted to the maximum important organs such as the heart, lungs, and brain, and away from the muscle groups. In case you note any of the signs mentioned on this slideshow, see your health practitioner or go to an emergency department right away. When you have any chance elements for coronary heart ailment, it's far specially essential to be aware of your frame and get any signs and symptoms checked out by a medical doctor. Getting set off clinical attention can also save your existence.